All right. Welcome back to Behind the Lab Co., the podcast where we dive into the real stories of doctors, scientists, and educators to learn how they got where they are and what drives them forward. Today we're joined by Dr. Rahul Chug, a hospitalist in the Neurosciences department at Community Regional Medical Center in Fresno. Dr. Chug completed his undergraduate degree in biochemistry at UCLA, earned his medical degree from Touro University, and went on to complete his internal medicine residency at UCSF Fresno. His work focuses on diagnosing and managing patients with complex brain and spine conditions, combining critical care with deep compassion. He also has future plans to open his own medical practice, aiming to deliver high-quality, personalized care outside the hospital setting. Dr. Chug, it's an honor to have you with us. Welcome to the show.
Yes, thank you for inviting me. It's an honor to be here as well, talking to you guys and telling people my experience so they could, navigate, pretty much college, medical school, and residency to become doctors if, they choose to go there.
Yep, 100%. So let's start at the beginning. What first sparked your interest in science, and how did that evolve into pursuing a degree in biochemistry at UCLA?
Yeah, so, when I was young, I suffered extensive burn injuries during an accident, for which, like, I required multiple surgeries. I stayed at the hospital for pretty close to a month. And during this time, like, I developed very trusting and lifelong relationships with my doctors. So that kind of, from a very young age, kind of just imprinted in my mind that I also want to be a doctor one day. And when I was in high school or middle school, I really liked, science experiments that we used to do in our class. Like that kind of triggered me into possibly thinking about going into, biochemistry because I like both biology and chemistry, and then biochemistry kind of combines both of them. So that's kind of what helped me, kind of decide that I wanted to pursue biochemistry.
Okay, great. I know many people find biochem intimidating. What did you enjoy about it, and how did it prepare you for the path to medical school?
Yeah, I mean, it. I really found it exciting to learn, like how like different pathways, like biochemical pathways, can go wrong in like different diseases, like for example, cancer or diabetes. And then actually, you could use the same pathways to like come up with treatments. So actually, I realized that it has actually a lot of. It's not just interesting; it actually has life-saving applications. So I thought it was a good fit for me. And then especially because now that you are know about it, then you could use it in medical school and throughout, like, once you get training in residency. So I think it's actually a very good major for people who want to pursue medicine.
Yeah, great. Um, so moving on, what made you choose osteopathic medicine at Touro University? And was there something specific about the DO approach that resonated with you?
Yeah, I chose an osteopathic medical school because, I really connected with the holistic approach at the heart of osteopathic medicine. I've always believed that treating patients goes beyond just like addressing their symptoms. You have to understand their lifestyle, their environment, and mental health. And the DO philosophy of seeing the patient as a whole, it aligns with how I want to practice medicine. And then also they have a very heavy emphasis on preventative care. And then they also teach you osteopathic manipulative medicine, both of which like I had an interest in.
That's great. Um, so here's some follow-ups on that. Were there any mentors or key moments in undergrad or med school that shaped your journey?
Yeah, so I mean, throughout the whole training, like different parts of my training, like I had many mentors. In college, like I had teachers that kind of I asked for advice, counselors. And then specifically, when I was at UCLA, like one of the principal investigators that I worked with on a research project, she had actually a postdoc working for her at that time. And she kind of helped me a lot in terms of like, applying for medical school, like looking over my, personal statement and kind of guiding me at that time. And then even, within medical school, like a lot of professors and same thing in residency, like a lot of clinical professors that you have.
Yeah. So, also going into your residency and then your interest in internal medicine. Um, Internal medicine residency is known to be rigorous. So,
Mm.
how would you describe your experience at UCSF Fresno?
Yeah, my internal residency at UCSF Fresno, it was definitely like an intense, but like residency, like long hours. You don't get many days off. But it was an invaluable period of growth for me, both professionally and personally. It kind of provided me like with a very broad foundation in diagnosing and managing like a wide range of illnesses. Um, you know, Seeing patients in the emergency department, and then also like ended up seeing them throughout their whole hospital stay for sometimes for months. Like you see them, back to back to back over like, a few weeks. Um, and then I kind of learned how to manage like complex diseases, also learn to like critically think under pressure, and then developed strong clinical judgment, and then also refine my procedural skills.
Yeah, that's great. Speaking of patients, what kind of cases or patient situations really helped you grow as a physician during residency?
Yeah, we see many complex multi-system diseases where you're like actively managing like um, multiple conditions at the same time. Like somebody who could have like heart failure at the same time, the heart failure is actually causing kidney failure as well. So you're kind of treating both. So you kind of have to almost like prioritize your interventions to, and then kind of balance the risks and benefits of all the treatments you're going to do. Um, you see like a lot of high acuity situations as well, like people come in with like sepsis, causing their blood pressure to drop a lot, or they come in with respiratory failure where, they end up requiring like mechanical ventilation. So, you just it helped me like learn like timely decision making skills as well. So, all these cases pretty much helped me improve my clinical reasoning, also improve my communication skills. And then you kind of have to collaborate with like a lot of different doctors, nurses, social workers, case management. So you kind of almost do like a multidisciplinary approach to in treating these patients.
Yeah. So, I know internal medicine can be broad, I've heard. So, what drew you specifically to the neurosciences side of care?
Yeah. While I'm treating patients, like for the most part, like in neurosciences department where they come in with, some sort of brain or spinal cord disorder, I still get to focus on, their other conditions as well. But as far as like going into within the neurosciences department, I mean, I was just always kind of fascinated by the complexity of and elegance of the nervous system, because like the brain and the spinal cord essentially like control every aspect of who we are, like, our thoughts, our movements, our emotions. And if something goes wrong, it could be like life changing in many ways. So when I graduated residency, like this department was opening up where they're going to be treating many patients with all, you're kind of collaborating with neurology, neurosurgery, interventional neurology, radiology. So, and then as a hospitalist, like I had the opportunity to integrate into it. So I actually kind of just got lucky when I graduated. This kind of department was opening up. So, and I'm actually really happy that where I work, it's actually a great place to work.
Yeah. So I'm actually interested in the neurosciences as well.
Oh, nice.
I did a summer program in after sophomore year um, at Georgetown University.
Mm-hmm.
Um, yeah, so I'm pretty much towards your side right now, but we'll
Oh,
see where
nice.
that leads me.
Yeah, I
Um,
mean, it's always good to kind of have somewhat of an idea in terms of what you want to do, so you could actually, when you actually are applying for college or medical school, you can kind of get experiences somewhat related to that because it actually ends up helping you down the line. And it also helps you decide like if that field is actually for you. Sometimes because when I went into medical school, I actually went in thinking that I'm gonna be a surgeon. But after I did the rotations and kind of did several types of surgery rotations, I actually decided that I don't want to do that. And when I did my internal medicine rotation, that like really, I really connected with what these physicians were doing. So I ended up choosing a different field than what I went into. But regardless, like the experience either helps you, decide that whatever you're thinking and doing is right, or it tells you like, oh no, this is not for me. Let's go in a different direction. So yeah, I mean, hopefully, you know, and you can also, people like students and stuff, like if they want to get some experience, they can also like shadow me um, for like a day or so, just see how we do things here.
yeah, so would you say that the med school rotations kind of help you shape what kind of path you want to take in terms of
Mm-hmm.
your specialty?
Yeah, so in medical school, like the first 2 years are just like kind of like classroom, almost like how college is, right? You go to class, you take tests, and you do like, labs and stuff to kind of learn the material. It's pretty much like an extension of college. And but this last 2 years, then this is like a traditional med school. Like some schools do it differently, like you have some overlap. But this next 2 years, the last two basically. Third year, they make you rotate through different rotations pretty much. So like you'll do like 12 weeks with general surgery, like 12 weeks with family medicine, 12 weeks with internal medicine, something like some sort of structure where you get to rotate through pretty much all the major specialties. Like I think so the major ones are surgery, internal medicine, family medicine, pediatrics, OB-GYN, and I'm missing one, psychiatry. And then there's also like a few weeks where you can actually take other subspecialties as well. And then it's basically to help you decide which field you want to go into. So for example, some people come in and they're like, oh, I want to do ophthalmology. It's not one of the typical rotations, but if you have an interest in that, then you could set it up with your school and then you do that. And then fourth year, you kind of do more of the same, but you actually, whichever field you're interested in, you actually do sub internships at, you could go to different hospitals, not just your own, the hospital that's affiliated with your school. You could go to other hospitals and then do the same rotation in other hospitals and kind of see how things are at other places. And then also it kind of gives that you a chance to kind of show this other hospital and the program that what kind of work ethic you have, and possibly it'll help you apply and match into that program. So third and fourth year are a lot more like clinical, whereas like the first 2 years, it's more like kind of like an extension of college, like you're taking classes, but it's just much harder because they teach you a lot more in the first 2 years. Like it's a lot of learning.
Okay.
Hmm.
Okay, so um, going back into your everyday work, working with
Mhm.
brain and spine disorders. I know it requires fast and high stake decision making. So how do you stay sharp and calm under those kinds of pressure?
Yeah, I mean, mostly it's just relying on like preparation. We have protocols, and then we have like systematic approach to decision making. So when you have like emergencies like a stroke or a spinal cord compression, you understand that time is crucial, but you also have to understand that precision is as important as well. So you basically focus on what you can control, right? You could stay organized, you prioritize key information, and then you communicate clearly with the whole team. And then the other thing is you just kind of have to realize the importance of staying grounded, and you have to just trust your training, and keep the patient at the center of every decision. Yeah. So with experience, like, pressure becomes like a space for like focus rather than panic.
Okay.
Hmm.
So going back into kind of like what your job looks like. So as you're
Hmm.
currently serving as a hospitalist in the
Hmm.
neurosciences department,
Yes.
for the listeners, could you tell us exactly what this role entails?
Yeah. So a hospitalist is basically like a physician whose primary focus is in the general medical care of a hospitalized patient. So we're the ones that are like pretty much experts in inpatient care and diagnosing and treating like common hospital conditions. So some of the things that you would see is like, sepsis, for example, or respiratory failure or kidney failure. So we would be the ones like when they come to the emergency room, the emergency room physician would say like, okay, this patient needs to be admitted. We would be the ones to admit the patient and pretty much treat them throughout their hospital stay up until they're ready for discharge, and we would be the ones discharging them. Um, and meanwhile they're admitted, if we need help, like in terms of like, for example, if somebody comes in with a heart attack and one of their arteries is blocked and you need to get open up the artery, you would call a cardiologist, and then they can come in and they can put in a stent, or if they can just inflate it with a balloon, like whatever is required for that patient they will do. And then basically they will tell us like this is their recommendation in the sense, and then we kind of, if some other thing goes wrong, so for example, like now their kidneys are failing, so then we would call nephrologists to kind of come and help us out. So we kind of, in the sense, um, I'd like to use like a football terminology here. It's in a sense like a quarterback of the situation, where like whoever you need at that time, like you can consult and have them help you, but for the most part, you are the primary point of contact for the patient. So, and then pretty much all the way from the admission to discharge, like you're the one that if they need something, they go to you, and then you are the one that kind of decide how we're gonna finish up their workup and treat them.
Yeah, so your job really allows you to connect with different specialties and
Yes.
work with them close. That's great.
Yeah, and it's just not just doctors. Like we have to, also work with social workers, case management. So it's like nurses. So it's like you are constantly, working closely with a lot of different um, people. Also like physical therapists, occupational therapists, registered dietitians, speech therapists. So it's a lot of different fields that connect and to basically treat the patient. Yeah.
That's great. Um, so what are some of the most rewarding and the most challenging parts of your day-to-day work?
I mean, the rewarding is just it's just helping patients heal, like, and then you actually see how much like you can make a difference in somebody's life. So, for example, a patient that comes in with pneumonia, when they come into the emergency room, like sometimes it's so severe that they're not able to even finish a sentence. Like they're so short of breath, they're barely able to talk, they're like spiking high fevers, like they look so miserable. or like same thing with a heart failure, they're just so short of breath. And with our treatments that we do, you kind of pretty much see like a person change over like a few days back to what they should be, right? And the whole process, it's just kind of is very humbling in the sense like we were able to fix, this person or their family members are so happy. And then the gratitude they express to you when, they're feeling back to normal, that is very rewarding to hear. And it's like not doesn't happen just like once or twice. With every patient you see, you keep seeing this again and again and again, and it never gets old. It's always nice to hear. And, at the same time, the challenging aspect is sometimes, despite doing everything you do, you unfortunately like are not able to save them. Or even if you are able to save them, like something happens that has like a lifelong kind of like a morbidity for them. Like, for example, a patient comes in with stroke, you tried your best, you gave them all the treatments in, the time that you were supposed to do, but they still sometimes like end up, for example, with paralysis on one side of their body. So it's very challenging to see when that happens. Um, so that's the challenging part.
Yeah. So, moving forward, I know you've mentioned a goal of eventually opening your own medical practice. What kind of vision do you have for that space?
Yeah, I mean, I just want to probably open a patient-centered medical practice, pretty much prioritizing quality and compassionate care, while also integrating like evidence-based medicine and holistic understanding of each patient's needs. So basically, the primary emphasis would be on continuity of care, preventative health, and also basically increasing accessibility. And obviously, like I want to use technology as well because now we have like a lot more, AI and stuff that we can incorporate. So long term, like I envision like sorry, collaborative, like multidisciplinary, pretty much setting that you're focusing not just on treating illnesses, you're actually promoting wellness and education and community engagement as well.
Yeah, that's great. So, how do you think patient care can be improved in today's healthcare landscape? And how do you hope to contribute to that?
Yeah, I mean, patient care, can be improved. One of the things is just building stronger doctor-patient relationships, and then obviously like better use of technology like telehealth medicine, and then also, electronic health records. And then also like one of the biggest things that, I think we should emphasize is actually prevention of like diseases because it helps a lot if you can just prevent something from happening. So that's why, like, for example, vaccinations is like an idea that comes to mind. Like, vaccinations kind of can help prevent diseases that would never even exist if, people are vaccinated on time. Um, and then also, like, one of the biggest barriers a lot of times in treatment is actually addressing social determinants of health, other things that are like kind of intruding our patients from getting the care they need, whether it be like, transportation issues or like, to get to like a ride to their doctor's appointments or their therapy appointments, or they just don't have like enough money to buy their medications. So if you could somehow help them in that way, that would actually help the healthcare landscape quite a bit.
Yeah, so basically allowing for more access to healthcare and
Yes.
more early treatment so that
Yes.
diseases could be more controlled.
Yes. And then the earlier you catch, the more you can actually do, right? And
Yeah.
then the lesser, if they were to develop some sort of, lifelong comorbidities from it, you could lessen them the earlier you could catch them, you know.
Yeah, for sure. Um, so Moving on. So, for students thinking about internal medicine or hospitalist work, what are some traits they should be developing now?
So one of the traits, obviously, that honestly any doctor, if you go into medicine, empathy is actually a very important trait that they should have. Another thing that they should be developing is resilience, basically the ability to be able to handle stress and then setbacks and then also like long hours without losing their motivation. You should have a strong work ethic, because medicine demands like a lot of dedication, discipline, and consistent effort over many, many years. Another thing that they should be developing or, is communication skills. You have to be able to listen and explain clearly, to build trust and ensuring good patient care. Some of the other things that are important are teamwork. So because, like I said, we work with a lot of different disciplines within the hospital to treat patients, because it's like all collaborative, right? So you have to be respectful, reliable, in that sense. Um, and then one other thing is like, I think that helps is just curiosity, honestly. And then actually having a goal of just lifelong learning. There's always new treatments coming out for for illnesses, new medications, new procedures that we can offer. So as a doctor, you're never done learning. So you have to be able to continue to push yourself to keep learning with all the new things that are coming out. So I think those are some of the things that I think students should be focusing on developing while they're in high school, college.
Yeah, I totally agree. So, what's a common misconception about hospital medicine that you wish more people understood?
Yeah, one of the misconception is that, at least for hospital medicine, is that we just manage patient in a short term kind of time frame, and we don't really build meaningful relationships. But in reality, like hospitalists, they actually play a central role in coordinating the complex care that these patients are getting. So we actually end up advocating a lot of times for these patients in like their most vulnerable moments, right? We are the ones that kind of are bringing these consultants on, and sometimes, you know, we see the whole picture that they don't. So we have to kind of almost like kind of sell them like why this intervention is necessary at this time, like why this patient can't follow outpatient for this procedure, for example. We'll be like, no, 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 it needs to be done while they're in the hospital because of the acuity. So you actually end up, and then you also, educate them like how they can continue like doing things that are in their control for them to prevent getting rehospitalized. And sometimes these patients end up staying for, like I said, many, many months. Ideally, you want to get them discharged like within a few days, but sometimes that doesn't happen. So you actually end up developing like, pretty meaningful relationships with these patients. And I've had like patients where like I ran into them like somewhere outside the hospital, and they would like come up to me like, oh doctor, like do you remember me, like you've treated me like for this and that, like years down the line, like, and obviously like I don't remember, but like that's how much of an impact you can create on their lives. And it's like, when I suffered my burn injuries, like I still remember all the doctors that cared for me by name. So it's like you do have very meaningful, although they're brief, but very deeply impactful relationships with your patients.
Yeah, yeah, that was great. Well, Dr. Chug, thank you so much for taking us behind the lab coat today. Your path through biochemistry, residency, and now hospital-based neurosciences work as a reminder of how much skill, sacrifice, and heart goes into this profession. For all our listeners, whether you're a pre-med, a curious science student, or already in healthcare, we hope you walk away with a deeper appreciation for the people behind the scrubs. Be sure, until next time, stay curious, stay driven, and remember, when it comes to brain care, Dr. Chug's patients are in a very good headspace. Thank you very much.